When we were initially designing this trial, we wanted to look from a patient's perspective is which is a treatment that really is best for me. We knew that you could treat appendicitis with antibiotics, but we didn't know if you should from a patient's perspective. So the main finding for the CODA study was that at 30 days, patients that received antibiotics were no worse than patients that received surgery as a general quality of life health measure. We had primarily been looking at the treatment of appendicitis with antibiotics in terms of who eventually needed surgery. But surgeons felt like if you take an appendix out, you're 100% cured. And patients often said, I would do almost anything to avoid a knife. And so this really allowed for multiple different perspectives and looking at multiple outcomes so that patients could think about what their values were, what their concerns were, and really understand what the data was to make an informed treatment decision. From a surgeon's perspective, we always want to do the best for our patients, and we didn't have the data to really be able to inform them about what treatment looked like when we gave them antibiotics and what was the likelihood that they would eventually need surgery or that they would end up coming back to the emergency department or need multiple CT scans over time. And this, I think, really allows surgeons to be able to have more information when guiding their patients through different treatment options. I think from patients' perspective, they suddenly are going to have much more information that can be tailored to what their individual concerns and needs are. So we oftentimes see students that say things like, I have a final next week. Which treatment option is best to get me back to school? Or I'm going to be traveling to a really remote area. What's the likelihood that this will happen to me again? And we have very granular data, some of which is in this first paper, some of which we're planning for future papers, that will help inform patients on what the best choice is to fit within their own concerns and their lifestyles and their needs. I think part of the thing that we did really well in this trial is we had a video that was 7 minutes that explained what appendicitis was, what do we know about surgery, what do we know about antibiotics in the experience, and what does it mean to be in a randomized trial? Because it's not something most people in the United States have ever done before. And that allowed us to all feel like there was an ethical approach to giving patients information to make an informed decision on participating or not.